I'm Jason Shire, and welcome to Quick Gastro. This is a video on the internet, so we shouldn't be using this to diagnose or treat people with medical conditions. Read the fine print, but mostly this is just for education.
The words that we use matter. Mostly, we speak with local colloquialism that people close to us can understand. Sometimes those differences are minor. For instance, I live in Detroit, so we call it pop. A bunch of you people live on the East Coast and you call it soda. And it sounds frankly weird, but I understand what you're saying. Other times, though, the differences are important and can lead to confusion. This is the first video I made specifically for people living with IBD to help understand what the words the physician is using actually mean. I want to thank Bottom Line for suggesting the topic. The biggest question is understanding all the phrases of IBD. We start with a specific pattern where a person's immune system attacks the GI tract. This is inflammatory bowel disease, or IBD. Within this are two main subtypes, Crohn's disease and ulcerative colitis. Ulcerative colitis has some defining features, but most common is that it's usually limited to the colon. Crohn's, on the other hand, has several distinct features but can be anywhere in the GI tract, and this includes the colon. Since this one organ has overlap between the two, sometimes we have a hard time figuring out which one it is, and then we call it IBD undetermined or indeterminate colitis. This can be further divided, and this is where the confusion comes from. If the UC is only in the rectum, then we call this type ulcerative proctitis. While the inflammation extends past the rectum, it can be left-sided ulcerative colitis. If the majority of the colon is involved, we call it pancolonic UC. For Crohn's, it is often defined by which organ is involved. So the three most common are ileal Crohn's, colonic Crohn's, or a combination of the two, ileocolonic Crohn's. So now we have ulcerative colitis and Crohn's colitis. They both involve inflammation, they both are in the same organ, and for the most part the medications are the same. But fundamentally, the doctor may note some differences in how they behave or how best to treat them. The next word that trips people up is immunosuppression. Most people think that their immune system is like a light switch that's on or off. But in reality, it's like a control panel. And in IBD, maybe a few dials got turned too high. The majority of the settings are right where they need to be, but we don't need to turn them off or even make them low. We just want to turn them back to normal. So yes, immunosuppressants like biologics do turn down the immune system, but most parts of the immune system work just fine, and we're not trying to turn anything off. To do that, we use biologics. There are a lot of connotations with this term, but in short, anything that comes from living organisms can be considered a biologic. Your flu vaccine, it's a biologic. The heart valve harvested from a living animal, it's a biologic. In a sense, blood transfusions are biologics, insulin is a biologic. In our case, we've harnessed bacteria to make medications that we then harvest and use to help people live a better life. Living that better life is termed remission. This is a changing definition. Previously, it meant that people felt better, and that's clinical remission. We noticed some people felt well, but ultimately their GI tract was still inflamed. So when the tissue heals, that's called endoscopic remission. And of course, few people like being on steroids, so feeling well enough that you don't need steroids is called steroid-free remission. You can be in each of these at the same time, and that's called deep remission. Lastly, sometimes people go for surgery, and then even the doctors get the terms there wrong, and it can become confusing. If you have a section of bowel that comes to the surface of your abdomen, that is called an ostomy. The plastic bag that collects the stool is an ostomy bag. If you've had a surgery where your colon is removed and your small intestine is brought down to your anus in the form of a reservoir, this is a pouch. There are different types, such as S pouch and W pouch, but the most common type is a J pouch. If you have a pouch made from the small intestine that comes to the abdominal wall surface but does not require an ostomy bag, then this is most likely a continent ileostomy. So there are a lot of terms that are commonly misunderstood, and hopefully this will make communicating with your healthcare team a little easier. Stay safe.